Thank you for your participation. Information about vaccine accessibility and eligibility is changing quickly, and we wanted to offer a local and state update. I want to thank our guests for participating today. Our guests include Andrew Goldfrack, Director of the San Bernardino County Department of Public Health. He's the Chief Operating Officer for Arrowhead Regional Medical Center. Josh Dugas, Assistant Director for the San Bernardino County Department of Public Health. Dr. Sharon Wang, Chief of Infectious Diseases at Arrowhead Regional Medical Center. And Dr. Hasinda Abdul Amuda Kabar, also known as Dr. Jam, is the Assistant Professor of Pharmacy Practice and Critical Care Infectious Disease at Pharmacist at Loma Linda University School of Pharmacy. California and most of the nation have much to celebrate. Vaccine production, despite a few slowdowns, is moving forward at a good rate. We also have more people, including 16-year-olds, depending on area eligibility to take the vaccine. It's good news for families, schools, and businesses as we start to move forward with our economy. But we do have a few yellow lights on the road, caution to the state's recovery. Variants of the virus are widespread, and we are in a race to get as many people vaccinated as quickly as possible. That's the only way for us to reopen as soon as possible and as safely as possible. Vaccinations will help us be safe and feel safe. We want to spend time with loved ones, shop, enjoy a meal at a restaurant, but we also want to make sure that we are safe, that we are not infecting others, and we want to make sure that we avoid another shutdown. Vaccinations will get us there. But please, I still urge you to continue wearing masks, practice social distancing, practice washing our hands for 20 seconds, and other good health habits that we have been practicing. Now's not the time to let our guard down. Now's the time to continue to practice the safe health standards that we've been able to move forward with in COVID-19. We are not out of the woods yet. Warmer weather is coming, greater numbers of vaccinated people, highly positive rates, and fewer hospitalizations due to COVID are all good signs. But we are not out of the woods yet. And with summer coming around the corner, we'll want to get out and spend time with our families and friends and go to different things. But we need to make sure that we're practicing our social distancing. This deadly virus seems to always have another trick up its sleeve, such as faster spreading COVID mutants. And this is a big caution for us here in the state of California. California has holding its own so far, but we see states like Michigan, New York, Pennsylvania, New Jersey, and others with new surges. This is troubling, and why we need to continue to practice safety measures as California begins to open up and children return to school. Today, to help us understand what is happening here in San Bernardino County, we are fortunate to have Andrew Goldfrack, Interim Director of San Bernardino County Department of Public Health and Chief Operating Officer for Arrowhead Regional Medical Center. Josh Dugas, Assistant Director for the San Bernardino County Department of Public Health. Sharon Wang, Chief of Infectious Diseases at Arrowhead Regional Medical Center. And Dr. Hasinda Abdul Muda Kabar, also known as Dr. Jam, Assistant Professor of Pharmacy and Practice of Critical Care Infectious Disease at Pharmacist at Loma Linda University School of Pharmacy. Those will be our speakers today. And let me begin with our first speaker, Andrew Goldfrack, our San Bernardino County Department of Public Health Interim Director and Chief Operating Officer of the Arrowhead Regional Medical Center. He has been with the county since March of 2020 and worked in healthcare management for almost 15 years. Over the past several months, he has helped lead the efforts of the county's COVID-19 Vaccination Task Force in coordination with the Department of Public Health and other county agencies. Andrew Goldfrack, Director of San Bernardino County Department of Public Health and Chief Operating Officer for Arrowhead Regional Medical Center. He will share an update of where we are with the virus here in the county and vaccine distribution and availability. Join me in welcoming Dr. Andrew Goldfrack.
Hi, good morning, and thank you very much, Mr. Assemblymember. And it's a privilege to be here today to be part of this panel and to talk about where we stand with COVID-19 in San Bernardino County. As you mentioned, we've come a long way, and we are making great strides in our fight against COVID-19, but we still do have a long way to go. We do have a slide deck that we would like to share with you, and I want to start by talking a little bit about where we are within our tiers. And so if we go to the next slide, please. Very excited to say that on April 7th, we did move to the moderate or orange tier within the safer blueprint for the state of California. That's primarily been driven because of our daily case rates per 100,000, our positivity test percentages, as well as our health equity goals. What this does is it allows more access, more openness for individuals within the county to be able to start to re-engage, to be able to start to gather socially, whether it be outdoors or indoors, go to movies, go to restaurants, but it is done at a limited capacity, a little bit more than in the red tier, but still at a limited capacity. And it is important that for those individuals that do go out, to please continue to maintain social distancing, please continue to maintain proper hand hygiene. And if you aren't feeling well, please make sure that you do end up staying home, because we want to continue that trajectory from going from orange to yellow and then ultimately to an open economy. If we go to the next slide, please, I want to share a little bit about where our numbers are as of today. So we updated this morning, and totally within the county of San Bernardino, we have 288,929 confirmed cases within of COVID-19. That brings us to an adjusted case rate of 3.9 per 100,000 individuals. I will say that number has been relatively steady at around that 3.8, 3.9 mark for the past couple of days. We are unfortunately seeing a slight uptick in that number, but it is remaining relatively stable. Our positivity rate is at 2.1, and our total deaths is about 4,500. Our test per 100,000 is 280. The positivity rate, which is a great news, that actually is a trigger for the yellow tier. So we are starting to make that progress, and if we continue to maintain our vigilance in what we do, maintain our practices that we've become accustomed to, I could see us just continuing to move very nicely throughout the tier system. If we go to the next slide, please. One of the things that's really important is, in addition to our testing, is to vaccinate and to get vaccinated where appropriate or where you can. We do have multiple options for vaccines. As you know, on April 6th, the County Board of Supervisors did open up the age constrictions to 16 plus. That allowed us to really start to vaccinate our entire adult communities throughout the entire county. It's important to note, however, that of the vaccines that are available, Pfizer is the only vaccine that has the emergency use authorization from the FDA for ages 16 and 17, whereas the other vaccines, Moderna and while now temporarily paused, Johnson & Johnson, are 18 and older. The Pfizer is primarily offered at our county-run sites, our state sites, and at a few hospitals, whereas Moderna and J&J are through hospitals, physician practices, and pharmacies. If you go to the next slide, please. One of our big focuses at the county and throughout our entire initiative on vaccines is around equity. It's really important for us to provide vaccines close to home in the communities and not in one central location. We also recognize that there is a significant vaccine hesitancy. And I know that our clinical panelists on the call today will be talking more about that. But I just wanted to share a lot of the work that we've been doing in terms of equity. And we hold monthly meetings with our vaccine equity work group. That's a combination between public health, community providers, behavioral health. We have over 20 providers that attend these meetings, including the Inland Empire HIV Planning Council, Young Visionaries, West Side Action Group, the Mexican Consulate, the Inland Empire Concerned African American Churches, Pacific Islanders, El Sol, and others. We also work very closely with the Tri-County Community Partnership and trusted community partners and providers in our messaging. It's really important that we work within those communities to message the vaccines by those that are trusted within those communities. And we've been successful. We still have ways to go, but we've been relatively successful in reaching those communities because of our relationships with those trusted providers. If you go to the next slide, please. As you all heard yesterday, in a joint statement between the CDC and the FDA, there was a decision to pause the Johnson & Johnson vaccination due to 6 reported cases of a rare and severe blood clot following those vaccines. The CDC is currently meeting today, actually, as we speak, to evaluate and to research those 6 particular cases in more detail, as well as provide additional guidance. So at this point, early yesterday morning, we not only we made the decision to direct all stop of the J&J until further notice, really at an abundance of caution and safety, as safety is our number one priority with our community. The symptoms for the blood clots tend to be around developing severe headaches, abdominal pain, leg pains, or shortness of breath within about 3 weeks after the vaccine. And if anyone does experience those symptoms, those individuals are urged to reach out to their local healthcare provider. If you go to the next slide, please. I'm now going to turn it over to Josh Dugas, who's the Assistant Director for the Department of Public Health, to talk more about the vaccines and numbers. Josh?
Good morning, everyone, and thank you, Assemblyman, for having me. If you could go to the next slide, please. So we in San Bernardino County have worked really hard to set up a vast vaccination network to allow people, as Andrew alluded to, the ability to receive vaccinations near their home and hopefully eliminate some of those challenges that may be associated with traveling long distances to get vaccinated. So you can see from this slide, we have 7 county-run sites, and they're spread out through our county. You can see the cities there, and we also have our partners over at Arrowhead Regional Medical Center that are doing vaccines as well. We currently have 2 state-run sites, and there's one in Bloomington and Yucaipa. And then we have 238 other providers. And these include other area hospitals, pharmacies, physician practices, and they are really spread out throughout the county. And we're very confident that if someone needs to get vaccinated, even in some of our more outlying areas, they'll be able to find a resource to do that. And should they not be able to find one, we encourage them to reach out to us and maybe we can help them find one. Next slide, please. Wanted to present this. These are some actual numbers as of this morning, where we stand with vaccination. You can see from that total residents vaccinated, that's 928,702. That is total doses received. So that's not people that are totally vaccinated, but you can see right under it, fully vaccinated is 354,738, or a little over 21% of our county has been fully vaccinated at this point, which is a huge achievement, but we're not there yet, and we know that, so we're going to keep working hard to get there. Next slide, please. One change you are going to see is that San Bernardino County will be and many of our partners will be transitioning to the My Turn system. This is a new scheduling system. It's pretty intuitive to use, and hopefully people will be able to navigate it pretty easily. You can still go to our website, the SB COVID-19, and there'll be links to schedule appointments, or you can also go to myturn.ca.gov, and it will list eligible vaccination sites that you can sign up for. It has multilingual support, so hopefully we'll be able to help those that speak or read multiple languages and help facilitate them getting appointments. And should anyone ever need assistance at any point in scheduling an appointment, they can call our Joint Information Center, and you can see the number on the bottom of the slide there, 909-387-3911. And with that, I will go ahead and turn it back over to you, Assemblyman Ramos. Thank you.
Hi, thank you, Mr. Assemblymember, for inviting me to join the panel. I'm very excited to talk about vaccine safety and address some of the concerns that members may have. You know, we are making strides in getting the shots into people's arm, but we can do more, and we need to do more. Next. All right, so what's on the menu? What is available to us? And like Mr. Goldfrack said before, we have the Pfizer and the Moderna, and then the most recent one that became available is the J&J, which is on pause for now, and we will know more. The first two are the mRNA vaccines that are 2 doses, and the J&J is the single dose for 18 and up, and it uses a slightly different mechanism. Go ahead, next. So there are different platforms and mechanisms when it comes to vaccine, but the goal for any vaccine is to trigger your body's immune response to develop antibodies, which will fight against the microbe that's in question. So you can see the number 3, the bottom one, this is the mRNA technology, and that's used in Pfizer and Moderna to induce your body to produce antibody. The Johnson & Johnson is using a more traditional virus vector, a dead adenovirus vector, to carry the message to your body to induce that antibody. So the goal for any vaccine is to protect you without causing you to have the infection itself. Next. So one of the biggest questions people always ask me is, how is it possible that we can develop a vaccine in just under a year? Well, let me share with you, the mRNA vaccine technology is not new. It has been studied in many different infections, and also for skin cancer treatment and lung disease treatment. Coronaviruses, this is not a new virus that all of a sudden popped around. So scientists have been studying various coronaviruses for over 50 years. So when the pandemic hit in 2020, this became the main focus for everyone. So there's worldwide collaboration between all the scientists, the funding became available, and there are large scale trials. So everything was done in an accelerated timeline, but without compromising the quality that went into developing the COVID vaccine. Next. So every drug, every approved FDA product goes through trials, and for all three, there were over 40,000 people enrolled in phase 3 trial, and you can see most of them are done in the US with a good variety or distribution of racial and ethnic background, and involving adults, range from 18 and up. And so between Pfizer and Moderna, there were over 70,000 people tested even before it became available on the market. Next slide. And same thing for the Johnson & Johnson, there were 44,000 people enrolled in the phase 3 trial. And you can see the breakdown here as well. Go ahead. So once all 3 got emergency approval, this is where we are. We're trying to get the vaccines into the arms. first thing we learn in medical school is do no harm. Whatever we recommend, the number one thing is to make sure you don't harm your patient. So let's talk about the risk versus the benefit of getting vaccinated. The risks include the unknowns, the side effects, which I'll address, the possible severe reactions, including allergy. And some people say, I already got natural immunity from the infection. I already got COVID. Why should I be vaccinated? Well, we don't know how long your protection from having a disease will last, and if you will be reinfected down the road, if you will get reinfected with the variants. So natural immunity alone is not enough to protect you. Let's look at the benefits. It prevents symptomatic and severe infection, and I'll share with you some numbers. It gives you the antibodies to fight off the virus without you having to experience the illness. This is an important one. Protect your loved ones, the ones who are not qualified, the children who are not qualified to be vaccinated yet. By you being vaccinated, by you protected, you're less likely to transmit the infection to those who cannot be vaccinated. This is one part, one tool of the solution to ending the pandemic. And it helped us move to the next tier. And you can see it, we went from purple, red to now we're in orange. So this is helping us. And one last benefit is that that virus cannot mutate. We keep hearing about the variants. So we're competing against the virus. They're mutating because they are trying to survive, and we're trying to get vaccinated so we can outcompete them, and they will not be enough, unvaccinated people to spread the virus and allow the virus to mutate. So that's also a benefit. Next. Let's do the math. We hear these numbers in the news everywhere. Over 50,000 deaths, over 500,000 deaths in the US from COVID-19 since the pandemic, and almost 3 million people have died worldwide from it. But look at this table on the right. These are the study participants from each of the vaccines we discussed, and 0 died from COVID, 0 died from the vaccine, and 0 hospitalized. And these numbers are holding steady. After the vaccines were introduced to the general population, the vaccine-related severe allergic response or anaphylaxis was 11 cases per million, and there were less than 1% adverse events reported. So look at the number. This is fact. Next. And the vaccines is 100% effective at preventing someone from dying from COVID. Next. So side effects, right? There's no free lunch. Well, the vaccines are free, but you might experience some side effects, and let's talk about them. Next. On the arm that you get the shot, some people have pain. Most people actually experience pain and swelling. So I always say, when you're at the site, at the vaccine site, get the shot in the arm that you don't sleep on, because it's very uncomfortable to sleep on the side where you got the shot that day. The symptoms usually occur within the first couple of days after you get the shot, and they should go away within 2 to 3 days. Side effects may be more pronounced in younger people and with the second dose for the Moderna and the Pfizer vaccines. Some people may not experience any side effect, and that doesn't mean the vaccine didn't work. Some people may have flu-like symptoms. You just feel really tired, body aches, fever. Those are all part of the side effects, expected side effects. Next slide. If you like numbers, percent, so actually less than 20% may experience fever. So it's not uncommon to have fever after the vaccine. And again, all 3 vaccine side effect profile are very similar. But I do want to say, changing taste, cough, and shortness of breath are not COVID vaccine side effects. but the flu-like symptoms like body ache, joint pain, diarrhea may be the side effects. So there's still some distinction between COVID infection versus the side effect from the vaccine. Next. So if I haven't convinced you, let's talk about some of the perks of after you're getting vaccinated. But there are some behavior changes, which we'll talk about. But for the most part, we still have to do everything we do. Again, getting vaccinated is one tool. You don't throw away your other tools. So keep wearing your mask, keep washing your hands, keep staying away from crowded areas and large gatherings. And the reason for this is that we're still gathering data and studying to see if the vaccine can stop the spread. And the data is looking really good. How the vaccines work against the mutated variant, and then how long your vaccine protection lasts. If this is going to become a seasonal thing that we need booster, it's too early to tell, but keep wearing your mask and let the scientists figure this out and give more guidance down the road based on evidence. Next slide. So CDC updated this, right? The perks of being vaccinated. You can eat with your loved ones who are also vaccinated without your mask. So I actually last weekend, I sat down on the same table with my parents for the first time in this, for 13 months, and I almost cried. We usually eat separately. I'm in the kitchen, they're somewhere on the other end of the house, but this was the first time we sat down together. Right, so you can visit fully vaccinated with fully vaccinated. And if you inadvertently had a COVID exposure, you don't need to be quarantined or test if you don't have any symptoms. Next. And you can find this was taken directly from CDC, the do's and the don'ts, the activities that are green light after you're vaccinated. Next. Okay, so some of the questions, and if there's some questions that my slides don't cover, we can address that in a little bit. Next. So the mutated coronavirus, we hear about this, and every day it seems like there's another new variant that's circulating. That's what viruses do. They mutate, survival of the fittest. They got to mutate to survive. So we know that the Pfizer and Moderna vaccine do have activity against the UK variant. The South Africa variant, it's less immune response, but it still offers protection. And then there are other variants you hear about. The significance is unknown. For the J&J single dose vaccine, this was done when there were the South African variants that were circulating, and the protection, it protects against severe disease in the area that were tested. So in South Africa, there were 95% of the circulating virus were the B1351 variant. And in Brazil, it was the Brazilian variant, and they were effective in preventing severe disease. Next. Now that we have 3 or 2.5 vaccine choices, the J&J vaccine it is good enough as an additional tool to battle the pandemic. And we will hear more about what to do in the next, a few days to weeks as the scientists are discussing what to do. But they are effective. Go ahead, next. Some people have gotten COVID already. Do they still need a vaccine? And the answer is yes. Vaccine-induced immunity. So the protection you get from vaccine is much stronger, and it will last longer typically than the protection you get from getting the infection. And again, like I said, it may protect against the mutated variants. Next. Will the vaccine change my gene? It won't. It doesn't affect your ability to get pregnant. It doesn't cause cancer. It's not part of your DNA. It doesn't cause infections after you get vaccinated. Next. allergies, people who have severe allergy to medication and seasonal allergies, unless you're allergic to the components of the vaccine, which can be found on the CDC website, there is no contraindication to getting the COVID vaccine, even if you have allergies, severe allergies. And that's why we monitor you after each dose for 15 minutes. If you have history of allergies, you let the providers know at the vaccine site and they will monitor you for 30 minutes. Most of the severe reactions occur within the first 30 minutes of the vaccine administration. So that's why we keep you monitored. Next. This question comes up all the time: pregnant or breastfeeding? This is a personal choice and it's best for you to discuss with your doctors. It's the risk versus the benefit. We know that pregnant patients who get COVID are much higher risk for severe illness than a non-pregnant counterpart. The risk is there are limited data on safety of the vaccine in pregnant or lactating people. But if you do decide the side effects are no different, the Society for OBGYN recommends that, have a conversation with your doctors. I talked to many expert OBs and they all recommend pregnant patients be vaccinated. CDC states the vaccines are authorized to be given to pregnant and lactating patients. So it's a decision to have. And the side effects are no different. You're not gonna have more robust side effects because you are pregnant. And as for the benefit of getting vaccinated while you're lactating, is that there's robust immune response that you develop, and this antibody is transferred to the placenta and in the breast milk. So your baby has passive immunity. Your baby is protected through the breast milk and also in utero. So that is the benefit. That study just came out. So that is one benefit for pregnant and lactating moms. Next. So Pfizer, Moderna, Johnson & Johnson, which one is the best? The one that you can get, if that is available to you, is the best. And the analogy I always get is, if your roof is leaking, you're going to grab the bucket that's closest to you to catch the water, right? You're not gonna wait for Amazon to deliver you, the bucket of your choice in 48 hours or whatever Prime gets you now. So the one that's available to you is the best one for you. When you go to the My Turn, it will indicate which site has which vaccine, I believe. So between the Moderna and the Pfizer, and even the J&J, I would say full immunity. So the difference is the time to achieving what CDC says full immunity. It's 2 weeks after your last dose. So if you get the J&J dose today, that's it, it's not on pause anymore. In 2 weeks, you will have full immunity, versus with the Moderna, it's 6 weeks. So it's a 1 dose and then week 4, and then full immunity is considered 2 weeks after that. And for the Pfizer is 5 weeks. So that is the best difference I can find. But I would not wait days, weeks to get the one vaccine you want, because they are similar. Go ahead next. These are my references, and thank you so much.
Thank you, Dr. Wang, for that insightful information that we have. Next, we have with us Dr. Hasina Abdul Mutakabar, also known as Dr. Jam. She is an assistant professor at pharmacy practice and critical care infectious disease pharmacist at Loma Linda University School of Pharmacy. She is the lead pharmacist for Loma Linda University Health Mobile Vaccination Community Clinics. She manages the preparation of and transportation of all vaccines. She also educates community members about COVID-19 vaccines prior to clinics. She is thrilled to provide education to increase COVID-19 vaccine awareness and to strengthen community partnerships as a means of delivering equitable access to the vaccines. Dr. Jam.
Hi, everyone. I'm really excited to be here with you all and to discuss information pertaining to Loma Linda's response to COVID-19 vaccinations and the COVID-19. So I'm not sure if my slides will appear or if I should share my screen. Okay. My slides should say, yep, that's mine. We can start from the beginning. Alrighty. Well, next slide, please. So yes, so we currently have the largest actual vaccination site of San Bernardino County. So that is the Drayson Center, which you all can see pictured right there. So at the Drayson Center, we have vaccinated more than 20,000 individuals with the COVID-19 vaccine. So we are really, really excited about that. We have also had the pleasure of having Governor Newsom come to our clinics and visit and support our efforts. But at Drayson, oh yeah, I stated that we've vaccinated over 20,000 individuals. But I think what's even greater about our efforts at Loma Linda, and then we can go to the next slide where everyone can see just how we've had Governor Newsom support. But at Loma Linda, our efforts have been interdisciplinary, meaning that we have had dentists, that we've had respiratory therapists, we've had physicians, we've had pharmacists. This was actually led by the School of Pharmacy and by my boss, our dean, Dr. Michael Hogue, who has been a prominent figure in these vaccinations being delivered at Loma Linda. You can see Dr. Richard Hart there too, who's also supported our effort. But this has been pretty much and very much an interdisciplinary effort at Loma Linda. So we've all come together to really make sure that we've been able to vaccinate the community. But we started the Drayson Center in January. And in January, we had vaccinated, around 12,000, or from January to February, around 12,000 or so individuals. And of those individuals that have been vaccinated, we had only vaccinated about 3% of Black individuals. And we know that our minoritized communities, so Black, Latin, Native American, represent just the bulk of the individuals that are hospitalized. So very much disproportionate to what they represent in United States demographics in terms of hospitalization. So what that means is that we decided that we needed to make more concerted efforts to make sure that we could target our minoritized communities. So at Loma Linda, we have developed what we call our mobile vaccination clinics, where they're mobile in that we actually mobilize our services and we pop up at different community settings, but we've catered them to the Black and Latin communities so that we could increase the amount of individuals that we were able to vaccinate and able to serve there. So, and at Loma Linda, as I said, we had only served 3% of individuals at the beginning of February. So that's when we decided to roll out this effort. So if we go to the next slide, I can kind of walk you through what we've done. So we begin with a joint community clinic, a joint faith summit. So we've really just used and we've really leveraged our relationships with Black faith leaders. So the prominent ones being Pastor Sam Casey of Congregations of Organized Prophetic Engagement, and then Bishop Kelvin Simmons of the Inland Empire of Concerned African American Churches. We've come together with them to use their platform to just deliver information to minoritized communities, so the primarily Black, and then we were connected via them to our Latin communities to reach them as well. But we begin with a faith summit. So what this faith summit does is it includes myself, as well as Dr. Bridget Petit, a Black psychologist, and Dr. Juan Carlos Belliard, our Assistant Vice President for Community Engagement, and we deliver information about COVID-19. I provide information in regards to the pharmacology of the vaccines. Dr. Petit provides information in terms of the fear that comes with vaccine hesitancy and healthcare mistrust. And then we go forth and we do these community clinics or equity clinics. The basis of our community clinics is that we include a paper-based registration system. So this paper-based registration system kind of helps us remove that barrier of actually having to go and register through the computer system, which is why which was a thought that we had as to why we did not have a lot of individuals of Black and Latin communities actually come to that Drayson clinic because of that barrier of Wi-Fi and internet access, right? So then following this, we then place the clinics in the community. So we take away that barrier of transportation because our Drayson Center is primarily in a suburban setting. So this allows for us to just expand our reach that we were seeing with Drayson. And we have pictures here of just the community clinic. So we have Miss Judy here, who is an RN that's actually showing a student how to vaccinate. So we get to engage our students and create just equity-minded healthcare professionals. And then we have a picture with me here with one of our community health workers or one of our church members that actually helped us in crowd control there at the community clinics, Miss Martha. And then we have Governor Newsom. He actually came to support our community clinic as well. We were excited to have him in his group there. We utilized the Johnson & Johnson vaccine prior to the pause here in our mobile clinic, and the governor's office actually supplied us with that vaccine to vaccinate. On one Friday, we did the Black community, and then the following Friday, we did the Latin community. We are now at Loma Linda. We are in accordance with the CDC as well as the FDA, and we have paused all J&J vaccines at the time. And we are waiting, as Dr. Wayne said, to receive word in regard to resuming following that pause. But we have paused. Those individuals that were slated to receive J&J will now receive either Pfizer or Moderna. We can go to the next slide, please. I really wanted to just put into context what these mobile clinics have meant in terms of expanding our reach of the mass vaccination clinics. So here we can see, this was at the end of February, the mass vaccination clinics who we had vaccinated. And we can see that we only vaccinated 579 of 17,000 vaccinees in the mass clinic, so our Drayson effort. When we look at these mobile clinics, we vaccinated 351 Black individuals. So that's about 83.5% in these community clinics where we were actually able to remove barriers that commonly exist. And we were able to deliver information and then have a culturally representative individual there. So that individual being me, I serve as the pharmacist that manages the vaccines, but I also am the lead clinician there at the clinics. We have a medical director who is a physician, but I serve as like the legs. So I run around and I make sure that the vaccinators know what they're supposed to do, but I'm also there for the community so that they know that someone representative is actually there making sure that the vaccines are drawn and appropriate for them. So that really is just our tiered approach to that. But we can see that it's been effective, right, in making sure that we're actually able to be equitable in the way that we deliver these vaccinations. So we have done, this is just from our first community clinic. As of date, we have done seven community clinics. We have done two dose, we've done 2 fully vaccinated Moderna clinics, one in the Black community and then one in the Latinx community. And in the Latinx community, we had a 98% return rate. In the Black community, we had an 87% return rate for that second dose. We'll be doing another clinic on April 30th. So hopefully we can say that we have a continued great return rate for the second dose. And then as far as Johnson & Johnson, we've done 2 whole clinics with the Johnson & Johnson vaccine. So we fully vaccinated about 1,300 individuals. So I'm so excited to be able to report that and just report how Loma Linda has just been. So in addition to the 30 to 40,000 somehow people that we vaccinated at the Drayson Center, we've been able to also be able to get into the community and make sure that we are equitable in our distribution I also recently vaccinated the homeless community, and that's
Yeah.
something that we want to continue being able to do, is just bringing that access there to those individuals that are a part of our majority affected groups in regard to COVID-19. So then we can just go to our final slide. And in the event that you would like to go to the Drayson Center, of course, now vaccinations are open to those individuals that are 16 and up for Pfizer only, and then 18 and older for Moderna. And then when Johnson & Johnson, when we find out how that's going to proceed for Johnson & Johnson, 18 and older for now. But as of right now, prior to when we receive information from the CDC, we'll be doing Pfizer and Moderna. You can register here at luh.org/vaccine to be added to our Drayson Center sign-up list. Thank you.
Thank you. Thank you, Dr. Abdul Kabar. Thank you for that insightful information and reaching out and bringing up the topic of the homeless, making sure we're getting the vaccinations out to the homeless out in our community, and that very informational presentation. Now we're going to have a few questions, a little time for questions that were sent to us, and Noelia Oriana of my staff will direct the questions to our presenters.
Thank you, Assemblymember. So for our first question will be for Andrew. And the question is, how do I get a vaccine? Oh, one second. Okay, can you try unmuting yourself now? Oh, there you go.
Okay, here we go. So thank you very much for the question, and love Zoom and technology. So in order to, how do I get a vaccine? It's actually really easy. People can either go to our county website, sbcovid19.com, and schedule an appointment at either a county site or one of our many private providers, whether it be hospitals, physician practices, or our pharmacies. If they have a struggle with getting access to our website, we do have our Joint Information Center, which people can call to help schedule for our county sites. We want to make sure that getting vaccines is easy to individuals. So whether it's wherever you live, people have that opportunity to get their vaccine.
Thank you. Our next question is for Dr. Wayne. Can I choose which COVID-19 vaccine I get?
Like I said earlier, to a certain extent, if you go on the SB County website or the My Turn and it says Moderna or Pfizer, and whichever schedule fits your schedule, you can pick that one. But don't wait around for days on end or weeks on end to get the vaccine again. They're not that much difference. The difference is the schedule and the age limitation. Thank you.
Thank you. And to follow up, I know you did touch on this briefly, but they just want to know, what are some of the most common side effects after getting a COVID-19 vaccine?
Pain, just arm pain. Don't lift that day. And with pain, with side effects, you can, if your doctor said you can take Tylenol or ibuprofen, it's okay to take it if you experience symptoms like body ache. It's just like you came down with the flu is what most people tell me, but most people say they're just tired. They're just tired for a few days. So fatigue and pain.
Thank you for that. For Dr. Jam, our next question is, how long is the immunity period for each vaccine?
So the short answer is we don't know yet. I think Dr. Wayne talked on this a bit. So we don't know how long. Of course, these studies are set to last for 2 years. So we received reports from our first quarterly marks. So we know at the very least, you're protected as far as with Moderna and Pfizer for about 6 months. So they began these studies about last June or so, excuse me, last June or so. So we'll likely have more information. I would assume, don't take this as law. So probably in the next 3 months or so, we'll get more information. So they just measure how much protection those individuals that have previously been vaccinated, how much protection do they still have? And are they still protected again? Do they still have the amount that's required to be protected against COVID-19, these various strains, based upon what they're able to actually measure? So we'll be able to know hopefully soon a little bit more information in terms of how long that protection will last. However, I always tell individuals prepare, to be vaccinated every year against COVID-19. And in the event that it changes, then, it'll be a pleasant surprise, but just, prepare for lack of a better way of saying this, the worst. And if the best comes along, then yay. But at least 6 months with Pfizer and Moderna.
Perfect. Thank you so much for that. Our next question is for Josh. Do I still need to wear a mask and social distance after I've received a vaccine?
So the CDC recommends that you still wear a mask and practice social distancing. As Dr. Wang said, we don't want to give up some of the other tools in our toolkit to help protect us. However, there are some allowances for fully vaccinated people to be able to eat and socialize with each other indoors. But we'd still recommend that it's you still take your precautions to protect yourself.
Perfect. Thank you. Our next question is for Dr. Wang. Can I get the vaccine if I have COVID-19 symptoms?
If you have COVID-19 symptoms, first thing is to find the closest drive-through and get tested, and isolate yourself until you get your results and your symptoms are gone. If you do test positive and let's say you do have COVID infection, you may get the vaccine after you're no longer considered to needing isolation. So you're no longer infectious, you can rejoin the community. It is advised that you do get vaccinated. However, if you do get antibody infusion as part of your COVID-19 treatment, then it's best to wait after 90 days. I hope that answers the question. Thank you.
Yes, it does. Thank you so much. To follow up with Andrew, what paperwork or identification is required to get the vaccine?
So you will need some type of identification that shows that either you work or you live within the county of San Bernardino. For minors and the Pfizer vaccines, we also are requiring that parents and or legal guardians are present with them to be able to consent to the vaccination. Ideally, it's a government issued ID, but we do require some type of ID.
Thank you. But to follow up with Dr. Jam, what are the differences between the Pfizer, BioNTech, and Moderna mRNA COVID-19 vaccines? I know maybe quite a few, so we're interested.
So actually, it's very minimal differences between both of the vaccines. So in short, both vaccines are mRNA vaccines. So what this means is we have mRNA readily inside of our bodies. mRNA tells our bodies specific proteins to make so that we can survive. So in this case, when you're injected with the vaccine, that mRNA then tells your body, hey, you need to make this spike protein that's significant to the coronavirus. So both of these vaccines do that because they both are mRNA based. They both send that message to make that spike protein that's specific to the coronavirus. Once our body sees that, our bodies say, hey, this isn't supposed to be here. And then our bodies make protection or antibodies against that spike protein there that the mRNA has told our bodies to make. So the difference is just the way that the company decided to pack that mRNA up. So Moderna actually decided to use more of a lipid or more of a fatty packing for the mRNA information. So they did that because if we have more of a fatty packing, then that means that we can have a longer duration between when you have to get that first and second injection. That was just what they decided to use to pack the mRNA information. They just had different ways that they imagined how they wanted that mRNA to be delivered. So that's pretty much the only difference between these two vaccines. And then in the clinical studies, we saw 8 individuals that developed COVID-19 after receiving the Pfizer vaccine, and then we saw 11 that developed COVID-19 after receiving that Moderna vaccine. So for Pfizer, it's about 95% efficacy there. And then with Moderna, it's about 94.1. So very minimal differences there. It's the difference of 3 people. So very minimal differences between those 2 vaccines.
Awesome. Well, that's good information to know. Our next question is, how do I report a problem or possible side effect to COVID-19 regarding the COVID-19 vaccine? And that one is for Josh.
So there's actually a website, and it's the Vaccine Adverse Event Reporting System, or VAERS, that you can find online. Or if you're having trouble maneuvering online, you can give our Joint Information Center a call at 909-387-3911, and we will help you report it.
Perfect. Thank you. Thank you for that. And to follow up, is there a cost for the COVID-19 vaccine?
No, if anyone's trying to charge you something, call us also, because that's against the law also.
Thank you. And to follow up again, how can a homebound senior over 65 receive a vaccine?
Currently, we're working with our Department of Aging and Adult Services to identify and help vaccinate those that are homebound. If you're aware of someone who needs that service, you can give our Joint Information Center a call. I feel like I'm plugging them a lot, but a lot of information goes to them. It's again 909-387-3911, and we're facilitating teams that are going out to people's homes and helping to vaccinate them. So we'll be able to hopefully get them scheduled and taken care of.
Perfect. And also I went ahead and plugged in the numbers in the chat if anyone is interested in looking or giving a call. For our final question, it will be for Andrew. For the new April 1st and April 15th opening for vaccines, is this still for a specific group, requirements like weight and certain health issues?
No, it's not. It is for everyone that is 16 years and older. And while the state's timeline was April 1st for 50 and older and April 15th for all, the County of San Bernardino Board of Supervisors made that decision on April 6th to open it to 16 and older for the entire county. So we've been in that tier. So really everyone that's been approved, where the vaccine is approved for, is eligible, regardless of medical conditions, where they work, all that. The only criteria is that they have to either live and or work in the county.
Perfect. That's awesome news. So with that, we'll conclude our Q&A. Assemblymember Ramos, I'll take it back to you. Thank you, everyone.
Well, thank you. And thank you for all the panelists coming forward and sharing your morning with us to update our community, San Bernardino County and others that are watching this from Zoom technology, and then we'll be posting on our Facebook the much needed information. Last time we had a webinar on this, we weren't as far as we are now with the vaccines and the different questions that have come forward, and the equity, learning more about the equity and the community clinics that are going out to the community to make sure that people are getting vaccinated, and covering areas such as the homelessness, making sure that we're always making sure that's part of a discussion when we start to move forward with vaccinations in our district itself. And a lot of data that was shared that Dr. Wang put forward, that 0 people have succumbed to COVID-19 once you get the vaccine. So whatever vaccine's available to you, go ahead and move forward and get that vaccine. That's the message that we want to make sure that we're getting out through these types of outreaches to our community. 1, make sure you're getting the vaccine. 2, continue to practice your social distancing and washing of the hands, making sure that we continue to keep ourselves safe and our loved ones. And we heard it here today that COVID-19 isn't new. It's been around for over 50 years. So we have to be able to move forward as a community and to be open to the vaccines that will be coming every year against COVID-19. I want to thank everybody for taking the time to come in and join us on this Zoom, and the presenters for the hard work that they're doing on the front lines. Continue to do that work and continue to know that we are supportive of the areas and the work that you're doing. Reach out to our office anytime if we could be of assistance. Thank you for attending.